Good morning, everyone. I'll be speaking about the perioperative Toripalimab plus platinum doublet chemotherapy versus chemotherapy in resectable stage 2-3 non-small cell lung cancer, interim event-free survival analysis of the phase III NEOTORCH study. This study was presented in ASCO 2023. This molecule, Toripalimab, is the first domestically developed anti-PD-1 antibody in China. It has already been approved for melanoma, nasopharyngeal cancer, and urothelial malignancies. So let's see what the study shows us. So this was the study design. Newly diagnosed resectable stage 2-3 non-small cell lung cancer patients, EGFR and ALK wild type, were enrolled. They were randomized into two arms. 3 cycles of neoadjuvant were given. In one arm, there was only platinum-based chemotherapy with placebo, and in the other arm, was platinum-based chemotherapy with Toripalimab. After 3 cycles, they underwent surgery. After surgery, one more cycle of the same regime was given, and after that maintenance, 13 cycles of Toripalimab 3 weekly versus placebo was done. The primary endpoints were event-free survival and major pathological response, and the secondary outcomes were PathCR, overall survival, and safety and feasibility of surgery. The stratification factors were as per the stage, as per lobectomy versus pneumonectomy, the kind of surgery, non-squamous versus squamous etiology, and PD-L1 expression. So they randomized total of 404 patients, 202 patients in both the arms. The baseline characteristics were well matched between the two groups. 90% patients were males, almost 78% were squamous histology, 2/3 were PD-L1 more than 1%, and 2/3 were stage 3A, 1/3 was stage 3B. So coming to the EFS analysis, this was the primary outcome. This shows the EFS was in favor of the Toripalimab arm with the hazard ratio of 0.4. The EFS in Toripalimab arm was not reached versus it was 15.1 months in the chemotherapy alone arm. The event-free analysis by the independent review committee, again it was in favor of the Toripalimab arm with hazard ratio of 0.4. If we look at the event-free survival in subgroup analysis, it was in favor of Toripalimab arm in all the subgroups analyzed, irrespective of the stage, PD-L1 expression or non-expression, pathological type, squamous and non-squamous. Looking at the EFS in PD-L1 expression subgroups, in those with PD-L1 expression more than 1%, the hazard ratio was 0.31. The median EFS was not reached versus 13.3 months. Whereas in those with less than 1%, the hazard ratio was 0.59. In both, it was in favor of the Toripalimab arm. The major pathological responses were 48.5% versus 8.4%. And the PathCR rates, which was the secondary endpoint, was 24.8% versus 1%. Overall survival analysis, this data is not mature, but it's also in favor of Toripalimab arm with hazard ratio of 0.62. And more than 90% patients who underwent surgery were able to undergo R0 resection in both the arms. So looking at the side effect profiles, the overall side effects were not statistically significant in the two arms. The side effects leading to discontinuation of Toripalimab were also not statistically significant. However, the most important and most common side effects were myelosuppression, AST and ALT increase, cough. The immune-related side effects were obviously higher in the immunotherapy arm. So the conclusion of this particular study, this showed that there was a significant event-free survival benefit by addition of this immunotherapy molecule Toripalimab arm in a perioperative setting, followed by 1 year of maintenance. The major pathological response rates and the PathCR rates were also higher in the immunotherapy arm. So this is another immunotherapy molecule to the already pre-existing ones, which can be utilized in a perioperative setting in resectable non-small cell lung cancer. Thank you very much.